we have the more details about the lateral and the medial walls of the nasal cavity. Is that right? Please remind me. Please remind me where where can I start? Please remind me. I think that I should talk about the more details of lateral wall and the medial wall, okay, paranasal sinuses. Last time, I think that we reached to the, I explained this slide, and I reached to the walls of the nasal cavity, I think. Yes, that's right. Is that right? Nobody's know? Okay. All right. Okay, just a moment. I can. There is a problem too. Okay. If you have my presentation, the cursor movement, red cursor, and my voice is clear. If everything it's okay, everything goes well. All right, let's have a look at this slide. Okay, in this picture, picture A, you see lateral wall of the nasal cavity. As you see in this picture, you can find that there is some parts of the cranial bones contribute to form lateral wall of the nasal cavity. This is the sagittal section of the nasal cavity, and you can take a look at the lateral wall. This is the body of the sphenoid, the yellow one related to the sphenoid bone, green related to, in this picture, and that picture, green indicates ethmoid bone. The maxilla is the pink. In this picture, maxilla pink, and this picture, pink is the maxilla. Dark pink or cyclamen related to the nasal bone, and you can see the remaining part of the nasal bone. The blue, blue-grayish, if you want to distinguish between or differ this color is differ from this bone. This is the palatine bone, blue, light blue, palatine bone, and you can see remaining part of the palatine bone here. Okay, this is the cartilages of the nose, external nose. The last time I explained completely about this. Alright, and the brown is inferior concha. Inferior concha is the individual bone in the cranium. Okay, but as you see in this picture, superior and the middle concha are related to the ethmoid bone. They are not separate bone. Okay, not like a inferior concha. Inferior concha is the separated bone, individual bone. We've got a right and left inferior concha bone. Okay, the lateral wall from posterior to anterior lateral wall consists of the medial plate of the pterygoid process of the sphenoid bone. This is the medial plate, okay, of pterygoid process. Pterygoid process is related to the sphenoid bone. Okay, and the next one is the perpendicular plate of the palatine bone. Perpendicular plate of the palatine bone. We can see perpendicular, vertical plate. And next one above, you've got a medial surface of the lateral mass of ethmoid bone. Green area is related to ethmoid bone, and in this view you can see superior concha, middle concha, and inferior to the ethmoid you've got the inferior concha. Therefore, we have superior, middle, and inferior concha. On lateral wall, please keep in mind the concha locate on lateral wall of nasal cavity. And inferior to inferior concha, you've got a part of the maxilla. You can see. The maxilla, the territory of the maxilla which contributes to lateral wall of the nasal cavity, you can follow. This is the territory of the maxillary bone, maxilla. And we come to the anterior part of the lateral wall. Above frontal bone you've got a small part of the frontal bone and the nasal bone, and you must consider contribution of the lacrimal bone. This is the lacrimal bone. Medial surface of the lacrimal bone contributes to form lateral wall of the nasal cavity. Nasal bone is actually you can see nasal bone in the orbit, in the medial part of the orbit. You can see nasal lacrimal bone, but the medial surface of this bone contributes to the lateral wall of the nasal cavity, as you see in this picture. All right, and then and after these bony contributions of the cranial bones, you've got a cartilages and the fibrofatty tissue on lateral wall. Cartilages consist of the lateral process of the septal cartilage, great or major ulnar cartilage, and a small ulnar cartilages, because the minor or a small ulnar cartilages consist of the 2 or 3 particles, it's 2 or 3 parts. Okay, and finally we've got a fibrofatty tissue or cuticular part of the nasal cavity. Okay, I check here, everything is okay. All right. This is the lateral wall of nasal cavity, and medial wall of nasal cavity is actually the nasal septum. In this picture, last time I showed you this simple picture. The pink partition is the nasal septum. Nasal septum is considered as medial wall for each half of nasal cavity. This is the coronal or frontal section, this picture C. And you can see nasal septum. A nasal septum for each half of nasal cavity is considered as the medial wall. This is the medial wall for this one, medial wall for that one. Okay? And now come with me in this picture, and you can see therefore nasal septum consists of the 2 parts, bony part, and the cartilaginous part. Bony part consists of the contributions from 2 bones, perpendicular plate of ethmoid bone, as I told you before, green is related to ethmoid bone. Green, ethmoid. Okay? And vomer bone. Vomer bone is individual bone. And this bone is one of the single bones in the cranium. Vomer bone. We've got a small or little contribution of some bones. For example, nasal crest of palatine bone, blue. Nasal crest of the maxillary bone, pink. Okay, this is the small contribution of these bones to form nasal septum or medial wall of nasal cavity. And you should consider the septal cartilage. Septal cartilage contributes to form medial wall and contributes to form lateral wall as well. This is the lateral process of the disc cartilage, and this is the median partition. This is the in this picture we are in the nasopharynx, and we are taking a look at the nasal half of nasal cavity from the back. Okay, and this is the nasal septum, and this is the bony part of nasal septum. Vomer bone, you can see, and the nasal crest of the palatine bone. This is the horizontal plate of the palatine bone, and the vertical or perpendicular plate of palatine bone as in the front of the medial plate of the pterygoid process. This is the pterygoid process of the sphenoid bone, and you can see the lateral plate, medial plate, and the pterygoid fossa is clear, is obvious in this view. Okay, and this is the bony part of nasal septum. All right, and this picture we will locate here. Okay, and We are taking a look at the nasal cavity from the choana. This is the choana, or posterior nasal aperture. Alright, anyway. And you can see contribution of the great alar cartilage or major alar cartilage. This is the medial crus of the major alar cartilage. I show you in another picture. In this picture you can see this is the horizontal. This is the horizontal section of the nasal cavity, and the maxillary sinus inside the maxilla. And this is the floor of the nasal cavity, and this is the nasal remaining part of the nasal septum. You can see here, this is the great alar cartilage, and this is the medial crus, lateral crus of the major alar cartilage. And you can see contribution of the medial crus of the major alar cartilage in the medial wall of the nasal cavity. This contribution, I mean. Okay? Alright, anyway. The lateral nasal wall, we can divide the lateral nasal wall in 10 parts. Vestibule is the first part of the nasal cavity, and the vestibule is limited between nares. This is the nares or anterior nares or nostril or anterior nasal aperture. Nares, nostril is the same, and vestibule area. And this elevated ridge or border is Lymen nasi. Therefore, vestibule is between nostril and the Lymen nasi. Above Lymen nasi, you've got the next part of the nasal cavity on lateral wall. This is the antrum or atrium. Antrum or atrium of the nasal cavity. This area in the front of the conchal area, and this area is the conchal area. Concha consists of the superior, middle, and inferior concha. In this picture is different from this picture because lateral wall, this is the skeleton of the lateral wall, and in this picture lateral wall is aligned with mucous membrane, in this picture. Because of this, you've got a even appearance in this picture. Alright, pretty close to the posterior nasal aperture or choana, this area choana, you have the orifice or opening of the pharyngeotympanic tube. Therefore, it's expected. This is expectable for transferring infection from nasal cavity to the middle ear by this opening or orifice. Okay, the pathogens or infection can enter into the pharyngeotympanic tube, and in the lateral part of this tube is middle ear or tympanic cavity. Therefore, middle ear or tympanic cavity will be infected, will be inflamed because of infection inside nasal cavity. Okay, and you heard before probably otitis media. Otitis media. Otitis media is the medical condition for infection of the middle ear or tympanic cavity. Infection of the middle ear or tympanic cavity. Otitis media. Otitis media. All right. And then nasal septum. Okay. And then next subject I would like to talk about that is the very important around the nasal cavity. We've got paranasal sinuses. Paranasal sinuses. Paranasal sinuses consist of some large cavities inside the neighbor bones and some small spaces in the ethmoid bone, which are air cells actually. Okay, in this picture you can see this is the frontal sinus, the large cavity, frontal sinuses inside the frontal bone. In this picture they are equal, but most of the time in the different persons and in the people, the frontal sinuses are different in size and sometimes absent on each side. Okay, for example, if you are examined in physical examination by a physician, sometimes you've got one frontal sinus and another one is absent. Okay, and you've got both frontal sinuses, but they are different in sizes. Nowadays anatomists believe in the frontal sinuses like a fingerprint is specific to person. Okay, they are like a fingerprint. I mean that on the basis of the outline of frontal sinuses, you can identify. You can be identified. All right. Anyway, in a normal person, we've got two frontal sinuses, two maxillary sinuses. Maxillary sinuses are the largest. Are the largest sinuses between other paranasal sinuses. Maxillary sinuses, they are very important. And sphenoidal sinuses, we've got two sphenoidal sinuses and there is a partition between them. And the next one are ethmoidal air cells. Ethmoidal air cells consist of the three groups: anterior, middle, and posterior air cells. And each group consists of the several air cells. The air cells, they are a small cavity. If you compare with the, for example, frontal sinus, sphenoidal sinus, and the maxillary sinus, they are small and a lot, and the many air cells you have in the lateral mass of the ethmoid bone. But all paranasal sinuses open into the nasal cavity. I mean that secretion, okay, the normal secretion of the each paranasal sinus reaches to the nasal cavity, Okay. 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 This is the coronal section. This is the coronal section of the cranium, and some of paranasal sinuses is obvious in this picture. For example, maxillary sinus. Please pay attention to the maxillary sinus. Bottom of this sinus is the lower than orifice of the or opening of this sinus to the nasal cavity. You can see this is way of the drainage of the secretion of maxillary sinus. This way, by this way, secretions from this sinus is drained into the nasal cavity, and the bottom of the or roof of the maxillary sinus is this level, and the orifice is this level. And because of this, most of the time, you've got an accumulation or collecting of the fluid inside the maxillary sinus. In this picture, green area, all green parts are related to the ethmoid bone. This is the perpendicular plate of ethmoid bone, which contributes to the medial wall of the nasal cavity, you can see. And this is the lateral mass of the ethmoid bone. This one, left side, right side. Okay. And this is the crystal gully. Crystal gully locates in the anterior cranial fossa. This area, anterior cranial fossa. And this is the cribriform plate of the ethmoid. The forms roof of each nasal cavity. There is a lot of foramina, many foramina in the cribriform plate, and the axons of the olfactory neurons pass through this cribriform plate for reaching to the olfactory bulb, which locates here. Alright, let's come back to the lateral mass. Lateral mass is has a critical key or critical features, because lateral surface of the lateral mass of ethmoid forms a part of medial wall of orbit, okay, and the medial surface of the lateral mass of ethmoid contributes to form a part of lateral wall of nasal cavity. In this picture I showed you, this is medial surface of the lateral mass, and this is lateral wall of the nasal cavity. And on medial surface of the lateral mass, you've got a superior concha and a middle concha. And I come back again to this picture, superior concha and the middle concha. And under each concha, you've got a space. This is the meatus, superior meatus, middle meatus. And some of paranasal sinuses drain into these spaces. Okay, these spaces, I mean that. Posterior ethmoidal sinus, which are 1 to 7 most of the time cells, drains into the superior meatus. Okay, opening of the posterior ethmoidal cells to the lateral wall of the superior meatus. Anterior group and the middle group are drained into the middle meatus. Anterior drains here, and middle ethmoidal air cell drain here. And another things about the middle ethmoidal sinus or air cells, a mass, a rounded mass around this group. Rounded mass as bulla ethmoidalis. This swelling, this rounded mass. All right, I'll show you the bulla ethmoidalis. Rounded swelling, okay, bulla ethmoid cells, and the opening of this sinus is here under cover of the middle meatus. We've got the openings of the anterior ethmoidal air cells under cover of the meatus, middle meatus as well here, and pretty close to the frontonasal duct, from frontal sinus to nasal cavity. There is a frontonasal duct, opens here. Below bulla ethmoidalis, you've got a sulcus. This sulcus. Below, this is the bulla ethmoidalis. Below bulla ethmoidalis, you've got a sulcus. This is the hiatus semilunaris. At the back of hiatus semilunaris, or posterior part of hiatus semilunaris, you've got the opening of the maxillary sinus. Therefore, the sum of important paranasal sinuses open into the middle meatus, because if we have a complete middle concha, the space under middle concha is the middle meatus. In next picture, we remove a part of middle concha, okay, under cover this area. Therefore, from anterior to posterior, we've got the opening frontal sinus, anterior ethmoidal air cells, middle ethmoidal air cells, and the maxillary sinus. And this is normal. This is natural for infection of the other paranasal sinus, which open here after sinusitis infection. Somebody has a frontal sinusitis, infectious frontal sinusitis. The few days after infection of the frontal sinus, the maxillary sinus is involved. or middle ethmoidal air cells is involved, or anterior ethmoidal air cells is involved, because all together open in the middle meatus. The passage and a part of the nasal cavity, we say sphenoethmoidal recess. Sphenoethmoidal, because the recesses are pouch, the here is between a sphenoid and the ethmoid. Because of this, we use this term, sphenoethmoidal recess. And this is the schematic, you can say, the schematic or very simple picture of the opening of the each paranasal sinuses on the lateral wall. Indicates, I would like to indicate this is the opening of the nasolacrimal duct. Nasolacrimal duct is between nasal cavity and the medial angle of the orbit, the here, medial angle of the orbit. The eye drop is accumulated the here and enters into the lacrimal sac. Inferior part of the lacrimal sac is the commencement point or superior end of nasolacrimal duct, and the lower end of the nasolacrimal duct are located here, inferior meatus, the space under cover inferior concha, the here. Okay, therefore, after crying, rhinaria or nose drop will be increased. Okay, will be increased. The secretion of the nasal cavity will be increased after crying, because eye conducted lacrimal duct. Alright, in this picture you can see blood supply of the nasal cavity. As I told you before, the sphenopalatine artery is the main artery to supply nasal cavity, and the sphenopalatine is one of the branches of the third part of the max of the sphenopalatine artery. This artery is divided into the lateral branches. You can see the septal branch of the sphenopalatine artery, lateral branch of the sphenopalatine artery for supplying lateral wall and the medial wall. We've got another sources like anterior ethmoidal and posterior ethmoidal are branched from here, from orbit they come here, and that has an anastomosis with the sphenopalatine artery. Another source from the greater palatine artery. Greater palatine artery is the branches of the third part of the maxillary artery by passing through incisive canal or nasopalatine canal, enters into the nasal cavity. You can see nasal cavity, and has an anastomosis with the medial terminal part of the greater palatine artery. We've got an important anastomosis in anterior nasal cavity. This is the Kesselbach anastomosis, and this anastomosis, because of exposure to the or very cold air, the capillary in the mucous membrane torn because of this exposure, especially to the dry air, will be torn, and we got a bleed. I'll show you in this picture. All right. Okay. The medical term for nosebleed, epistaxis, because of rupture of the tearing of the anterior anastomosis network, or Kesselbach anastomosis, yeah, Kesselbach plexus, Woodruff's plexus or little plexus. Sorry, little Kesselbach or little is the same. Posterior anastomosis, and they're not conducted to the nasopharynx, but hemorrhage from Kesselbach plexus is conducted to the nostril, and you can see like this. You can see nosebleed, but the hemorrhage from Woodruff's plexus is conducted to the nasopharynx. Don't notice the hemorrhage or bleeding. Okay. All right. And the venous drainage of the nasal cavity is down by the sphenopalatine vein, on the contrary to arterial branches. Arterial on the contrary to sphenopalatine, here, okay, anterior, posterior ethmoidal vein, sphenopalatine, because anterior and the posterior ethmoidal veins are drained into the sinus cavernosus, superior ophthalmic vein, and after that, a sphenopalatine vein is drained into the pterygoid plexus in infratemporal area. All right, and another thing is the nerve supply of the nasal cavity. Nerve supply of nasal cavity consists of the two classes or two categories, because we've got a special nerve supply. We've got a general nerve supply for nasal cavity. Nerve supply is provided nerve, anterior ethmoidal vein, the septal branch and the lateral branch, by 7 nasal branches, 7 maxillary nerve. Pituitary fossa has a 7 nasal nerves, which infer from a sternopalatin foramen and comes to the nasal cavity. They are divided into septal branch and the lateral branch. Lateral branch consists of the posterior, superior, lateral nasal nerves and the posterior, inferior, lateral nasal nerves. They come actually from greater palatine or descending palatine nerve. Okay. One of the branches of the nasal nerve from maxillary nerve is nasopalatine nerve. Nasopalatine nerve travels on medial wall of the nasal cavity, as you see in this picture, and the terminal part of the nasopalatine nerve reaches to the roof of oral cavity by passing through nasopalatine canal or incisive canal. Therefore, nasal cavity gives nerve, which nerve? Nasopalatine nerve, to the oral cavity, and then receives artery from oral cavity. Which artery? Terminal part of greater palatine artery. Greater palatine artery. Gets, okay, or receives artery, gives nerve. Which nerve? Nasopalatine nerve. Alright. Okay. Both the nasal cavity is the lymphatic drainage. If you divide nasal cavity into the posterior part and anterior part, okay, anterior part, lymphatic from anterior is drained into the submandibular lymph nodes, and the posterior half of nasal cavity, lymphatics from posterior part of nasal cavity is drained by the deep cervical lymph nodes. Deep cervical lymph node. I emphasize that submandibular lymph nodes is the one of the groups of the cervical lymph node. Therefore, anterior part of nasal cavity is drained by superficial cervical lymph node, submandibular lymph node, and the posterior part of nasal cavity is drained by deep cervical lymph node, sometimes to retropharyngeal lymph node. A part of the lymphatics goes there. Okay, for this session is enough. Okay, another things I this part of, okay, the olfactory cells locate at the roof of the nasal cavity. Okay, at the roof of the nasal cavity. In this picture you can show you. Okay, this is the olfactory cells or olfactory neurons. They are located in the mucous membrane of the roof of and the neighborhood area from the medial wall and lateral wall. The mucous membrane on the superior concha has an olfactory epithelium, and the roof as well. Okay, the axons, bundles, the axonal bundles of these neurons pass through cribriform plate of ethmoid. This is the cribriform plate of the ethmoid, and this is the impulses from olfactory cells which are irradiated by the odor molecules. Impulses is conveyed to the axons to the olfactory bulb, and this is the synapses for next olfactory tract, olfactory neurons, and the next olfactory neurons olfactory bulb, and it goes to the relevant area in the brain for perception of the perception of the smell. Okay. Therefore, this is the spatial sensory supply for nasal cavity by olfactory nerve. Olfactory nerve axons is considered as olfactory nerve. Olfactory nerve is the first cranial nerve. Is the first cranial nerve, and this is the general sensation. General sensation consists of the pain, pressure, warmth, and next session I will talk about the larynx and its relate. If you have any question, I'm here for